Hello, my name's Marie James and I live in West Wales in Carmarthenshire with my husband and younger son Tristan. Tristan was diagnosed with a rare genetic disorder, tuberous sclerosis, when he was 8 months old. He's now 27. Despite being severely affected with tuberous sclerosis complex, he is a young man that enjoys life to the full when his health permits. Tristan has, like many others with the condition, multiple tumours on his brain which cause epilepsy and autism and a learning disability. He also has tumours on his kidneys which are a cause for concern. In Wales, through the Institute of Medical Genetics, there have been remarkable advancements in scientific research into the inherited condition TSC. And we now have for the first time emerging treatments which have proved in research to be useful for treating patients in minimising tumours. The Welsh Assembly have been looking at reviewing processes for the individual patient funding requests recently, but the exceptionality criteria remains part of the process. This, we believe, is denying patients with rare disorders in Wales access to NHS funding for life-enhancing and life-saving treatments, and therefore the petition is calling for a review. With the support of 1,000 signatures, the petition is calling for a review of the current criteria of exceptionality within the IPFR process in Wales for patients with rare disorders to have fairer access to treatments.